Hello, welcome to Dr. Whisper's office. How can I help you? Okay, it's your first time with us? Okay, let me check the doctor's schedule and see if we have an opening for you. We take walk-ins too, but sometimes we have appointments, so I need to check if there is availability for right now. Okay, we have an opening actually in about half an hour. Right now the doctor is with a patient. Let's see. Yeah, it's the only opening we have for today. The other slots are taken by appointments. Would you like to take it? Okay, so first we need to open up a file with us. Can you give me please your full name? Okay, thank you. That's very beautiful. Yeah, I have heard a lot of names, but that one's cute. Now, I would like to know if you have an email or a place where we can contact you, which is the best for you. Okay? Go ahead. Very good. Thank you. And now, do you have your insurance number? Oh, thank you, a card. Very good. Let's see. Is all this information current? Oh, I see here the expiration date. Thank you. And now, before continuing, what is the reason of your visit? Okay. You're a little bit concerned with some issues in your skin, in your face. Okay, let me just add this to your file. This information is going to be available to the doctor once she is done with her current appointment. It's going to be showing on your screen. That's why I need to fill this up before you enter with her, okay? And since when did you have this problem? Okay, have you been treated before for this issue, or you want an assessment first? Okay. Now, these questions are for our medical file. It's something needed for the doctor to know your medical history before treating you or making an assessment, okay? Very well. In your family, your immediate family, which is mother and father, has there been any issues? Has there been any issues with chronic illnesses such as diabetes, cancer? Okay. Now, in the past 6 months, have you had any surgery, medical operation, anything of that sort that involve anesthesia, even if it's local or general? Dentist too? Okay. Oh, here's your card, your insurance card. Thank you. Yeah, sometimes I forget and I don't give it back, and my patient forgets too, so before I do that. Very good. How did you find out about us? Oh, really? So you really are a passerby that just walked in? Okay. Well, sometimes it happens, yes, that there's the right moment and you see, oh, I have to check this out. Yeah, I've had that done before with my nails. Can neglecting them. Then I passed through a nail salon. I remember. Yeah, I know, isn't it? Now you have to do appointments for everything, and with sometimes days ahead. Who has time for that? Especially with my memory. Okay, good. Now, with this issue that you're telling me, when did you start noticing it? That you believe that it was sign of concern for you? So you noticed that it started getting a little bit worse with time, but it's been there for... Okay, so it got worse in the last weeks? Oh, it started. Okay. Yeah, I understand. That is something definitely the doctor needs to know. Sometimes when it's something very sudden, it can be quite an emergency, of course. It's good that you came here. I'm also Dr. Whisper's assistant, so I can instruct you a little bit on it, okay? No, you're not understaffed. This is a small practice, so it's Dr. Whispers, myself as the assistant, and another two, but right now it's a little bit slow, so it's just me and the doctor. Okay, good. Have you taken any medication over the counter or with other doctors? No assessment whatsoever? Over-the-counter medication? Topical, of course. Also for the discomfort. Do you remember the name of the medication? Yeah, it sounds... Okay, yeah, we have it here actually in file. Oh, you have it here. Oh, thank you. Okay. Well, this is a very generalized topic cream that tends to have a lot of ingredients to hit or miss, right? But it's not the best when it's issues that maybe are more delicate. So I will suggest to stop taking it, okay? But the doctor is going to help you with that too. Yeah, it's advertised like that it will solve every skin problem. But the thing is that it's a hit or miss. It has so many ingredients that it might heal what you currently have, or it might make it worse because it has all these other ingredients. Yeah, the doctor here has so many cases where people are using this type of creams that are maybe curing something, but it's bringing more problems to the skin. So yeah, people normally buy it once and they don't use it again, but there are people that have skin problems that are chronic and they keep using it and using it and using it, and that brings even more issues for the skin. Okay, so when did you start taking this cream, put it in your skin? I'm sorry, this cream. How many times per day? Okay. Well, normally with skin assessment, the doctor takes, I would say 40 to 50 minutes. It's her range of time for this type of assessment. So, okay, can I see the cream again? Okay, it looks like a third of the cream, right, that you use. Okay, you need to put it in your information. Okay, good. Now, I have sent this information directly to the doctor. Once she's done with her current patient, she's going to start reading it and be prepared for you, okay? Now, I need to fill this out, okay? Since you're a new patient here with us, I would like to open this new file. We have already your name, contact information. Okay, have you had any signs of skin allergies, food allergies, any type of allergies that you know for? Okay. Have you ever had an allergy reaction flare up or an episode that is something concerning that maybe took you to the ER? Okay. Have you ever had any skin reactions to, let's say, grass, pollen, flowers, other type of plants? Have you ever had allergies to latex? How about soaps? Or detergents too? Detergents are actually something very common that has been quite a raise up right now. We've been having a lot of clients with no histories of skin allergies, and from, I would say, 6 months to this day, we have received quite a lot of clients and patients with this issue. So there's something that is going on with detergents right now. That's why we have to ask specifically with this kind of issues, especially for the skin and the face. It's kind of like a flare-up that has been going on the face when people are sleeping, of course, in their pillows. It's not going through the body, which is something very, very funny. It's going on in the cheeks area, but I don't see the symptoms on you. So when you go to hotels, yeah, sometimes they use the cheapest kind of detergent, so it kind of, yeah, not the best, of course. Any food allergy? Okay, but no skin reactions. Okay. Oops, okay. I had a notification from the doctor. She wants to know something. Okay, let me just reply. She's still with the other patient, but the patient is doing something else. And she asked if the cream that you are using, you recently bought it. Do you remember when you bought it? If you have the date. Okay, let me see. Okay, I think with the serial number we can. Okay, let me send it to the doctor. She has a little time. Okay. Oh, 1 moment, please. Yes? Oh, you're done? Okay. Okay, let me just get you your prescription that the doctor sent. Just 1 second. Okay. I see that the doctor prescribed this topic. And here's your prescription. Okay. And now you're going to be taking this as is instructed in the prescription, like the doctor tell you. And it's going to last you for around 3 weeks. Okay, here you go. Thank you. Of course. Any question, please feel free to call us. Of course. Bye-bye. Thank you so much. Okay, the doctor is going to be with you in a moment. You just need to take a break to get ready for you, okay? Very well. Let me just close this client's information, okay? Very good. Sorry about that. So, let's see. Just a couple more questions, and I'm gonna send this with the doctor so she can see you. Very well. Okay, no allergies. Have you had any problems with burning sensation with your current issue? Very good. Okay, just one moment. Let me give this to the doctor, okay? 1 second. Oh, hi, doctor. Hello. Yes, the patient's here. It's a walk-in, so we don't have any information besides what I send you into the system. Of course. Do you need anything else? Yes, I filled up, and of course the ones in the system. Okay, thank you. Yeah. Okay, thanks. Very good. Now the doctor is going to be ready for you in just a couple of minutes. Just finish up a few things before she can get to you. Okay. So, this is how it's going to go. So I was telling you, for assessment, skin assessment, the doctor takes around 40 to 50 minutes. Do you have this enough time? During this time, she's gonna be asking you a few questions that maybe I have asked you, and she might be also doing a few biopsies during the time, depending on your issue. But from when you are describing, she might actually take some of this testing and the biopsy from your skin. But don't worry, it doesn't hurt. She's just gonna be scraping a little bit and taking samples, just so you know that this is something that might happen. There is no needles involved, don't worry. And also, during this period of time, we also might take some blood testing, depending on how the issue is. The blood testing can be done here with us. We have that service available, and also other further testing that is also done here in the house. Normally those testing results take around, depending on the urgency, maybe 24 hours. But other times can be done in less time if we expedite them. Okay, do you have any questions? Okay, so let me just ask the doctor if she is ready for you. Okay, yeah, she's ready for you. If you can join me this way, please. Of course, please. This way, thank you. Dr. Whispers, here is the patient. Yeah, of course. If you need anything. Okay, I'm gonna be preparing that for the biopsies. Okay, thank you. It's okay. Very good. Okay, let's close today's schedule. We are full, and let's get ready for the next patient. Should be here in a little bit. And we're gonna put this on file. Hello, welcome. How can I help you? Oh, I'm sorry. We don't have any slots for today. Yeah, we just have one patient that took it right now. It's okay. But here's a card. You can call us tomorrow. Maybe we'll have an open slot, or you can make an appointment. Of course, please take care. Hello. I'm so happy to see you again. I was expecting you. Yeah, it's been so long. How you have been doing? Oh, I see. You've been having some issues with acne. It started breaking out. When did you notice this? Did you change makeup or maybe any creams that you're using in your face? Anything that is touching your face? Okay. And, well, this is more like a personal question. When you sleep, how often do you clean your bed sheets and especially your pillow? Okay. Do you have animals that sleep with you? I ask you these questions because sometimes it can trigger. Yeah, I ask you this because sometimes when our pets sleep with us, they can trigger some of these bacteria in our faces, even though they might be clean, but they tend to lick themselves. And if you have a very sensitive skin, can trigger these kind of situations, especially if your face is not something that tends to break out so easily. Or maybe you change detergents which you use to clean your sheets, pillowcases. How old are your pillows? Yeah, you know that it's recommended to change it every, I guess, 2 years, or wash them very, very good for them to keep clean. Yeah, because most of our skin, the dead skin cells, end up in our pillows, especially if you sleep on your side or with face down. So let's start by checking your face, okay? Let's do a quick assessment and see what we can do. I'm gonna disinfect my hands because now we know that there is a big sensitivity with you. You're not wearing anything at the moment? Makeup, sunscreen? Okay. You don't have any allergies to latex, right? Yeah, I don't remember you had any. Okay. Does it get itchy? Sometimes. But is it like itchiness right where it's breaking out? Oh, my hands are too wet to put on the gloves. Okay. No, I cannot touch you with my bare hands right now. You are breaking out, which means that there is something going on in your pores that is affecting you, and I don't want to add any more bacteria to it with my hands. Okay. So let's start here. Ooh, okay. A lot of dryness. And I see the breakouts. I'm gonna be poking a little bit. Let me know if it hurts. Does it hurt when I press here? How about here? Okay, first and mostly, there is dryness. We already know that you suffer of this issue, especially right now that we are in a cold season. Yeah. The areas that your breakouts are adding it's telling us that it's maybe not bacteria. It could be another underlying issue because it's located right here in your chin area, above forehead area, and in this part. Okay, let me tell you. Normally, the breakouts that we have when we have issues with bacteria, with the examples that I was telling you before, they tend to happen around this whole area, especially on the sides, on the cheeks, nose, that can lead to blackheads in the forehead. Now, the breakouts that you have a pattern which is located right down here only, and around these areas. So just on the sides. Oh yeah, I'm sorry, it's my cat, but she cannot enter this room. Absolutely. So this is consistent with breakouts due to hormonal issues and with other problems such as high sensitivity. You have very dry skin, but that is not the problem that creates the acne. So I'm quite sure that there is something going on with your hormones or with what you're eating right now. Have you changed diets? Maybe introduce a new food, something that you normally wouldn't eat, or a drink. This tends to happen too when some of my clients change milks. They go from cow milk to almond milk, oat milk. You're not quite sure? Well, what we can do today is do a full face cleanup, a deep pore cleanup that is going to allow to extract everything that is into those areas that is breaking out. Kind of like a clean slate, right? But the rest, it will have to be done with you at home. You have to keep notes, maybe in your phone, with what you're eating. If you're doing something new, sometimes we forget that we're eating something different, or we're trying something different with creams, anything that will touch your face, your phone especially. Never let your phone touch your face, especially here. You have no idea how many people I see with breakouts here, because they are always having their phone like this or touching their faces too much with their hands. So for you, it's consistent with a hormonal imbalance. I would suggest you to go to an endocrinologist that is going to help you with that. Because if it's something with your hormones that is triggering this, we have to know which hormones are being unbalanced. Most of the time can be because of the foods that we are intaking. Yes. But for now, we're going to help you clear up, at least from the outside. But if we don't take care of the underlying issue, there is not much that we can do, because it's going to return, okay? So I do recommend you to go to an endocrinologist and get a hormone test done. I have a few friends that I can recommend you, but again, you can look for yourself too. Very good. Start by cleaning your face. Now, This is gonna help clear your face. And then we're gonna do the deep pore cleaning. The breakouts are still gonna be there because we cannot touch it. If you touch them, you're gonna create maybe a scar. But what we are doing right now is gonna help them slowly going down. Maybe in a day or two, your face is gonna be completely clear. But as I'm saying, if there is something underlying issue, they're gonna come back in a couple of weeks. So I do recommend you to look into that with a professional, okay? Okay, this is gonna feel cold and kind of itchy. I'm gonna put it directly in the breakout areas. I'm gonna stipple it. So it might feel a little bit uncomfortable. I'm sorry, but it needs to be done. There we go. This is gonna help them dry out. So we are just putting them in these areas in a specific. Now the most important thing here is not to touch them at all. Even if you see a pimple that is ready to pop out, that you think is gonna pop out, don't touch it, okay? Very important. Give you a little mess here. Okay. You're gonna look straight forward. Very good. Yeah, it does feel good, right? Good. Might feel a little bit wet. That is normal. Okay, let's go with the next treatment. You're gonna go ahead and apply these drops that are gonna help soothe the skin. And it's kind of like a gentle exfoliation. Right now with your skin, everything has to be gentle. Might feel a bit oily. That's okay. Okay, let's try not to. We're gonna leave it there for a few minutes. While I do that, I'm gonna go and bring a face mask, okay? Now, we're just gonna keep it like that. Gonna add a bit of air so it can dry out. Yeah, isn't it adorable? Little bear. There we go. So So I'm gonna dim the lights a bit for you so you can relax, and I'll be back in a minute, okay? When I bring the face mask, just relax for the moment. I'll be back. Hi. Okay, I'm gonna turn on the light again. It was only 3 minutes. We don't need more. Okay, that looks fantastic. So now it's the wet part. Let me just protect your clothes. Okay, because I'm gonna be spraying you a bit. Now I want you to close your eyes, please. Just gonna cover your eyes so it doesn't go in. Yeah, it's a bit cold, but it's necessary for this. Let's wipe this off. Oof, yeah. I'm not saying that it's dirt, but yeah, those are the dead cells that we normally accumulate in our pores. I do suggest you, when you get home, to wash your pillow, all your bed sheets. Even if you have washed them yesterday, do it again and use a neutral soap detergent. Don't use Tide. That's the worst thing that you can use, especially for the face. For people with sensitive skin, it's the worst thing that you can use. Try to look for something that is neutral, that it's gonna be hard, but something that is for sensitive skins, and stay away from Tide. I cannot say for other brands, but that one in specific, most of my clients have had many breakouts due to that detergent in a specific. Yeah, it's pretty bad. I don't know why it's keep getting sold. What I use a Mexican detergent called Foca, which is amazing. It just mere soap. It doesn't have all these chemicals. Nope, it doesn't have fragrance, anything. It's just soap to clean your clothes. Yeah, they sell it here too. Normally I have bought it at Walmart, but they also have it in many Mexican markets. It's called Foca, like a seal, but Foca. 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 It has a little white seal on the label, and it's blue. And it's quite cheaper. So I do recommend you that detergent, and don't use any fabric softener. Fabric softener tends to leave residues in our clothes. That's why it smells. But those residues can cause harm on people with this kind of issues. It all depends on the person, of course. It all depends. What affects some, it might not affect others. But it's been studied that fabric softener is not good for us. Yeah, you can Google it. You'll be amazed what you can find that we are using on a day-to-day basis that is harming us. Okay. We're gonna finish up with our little nail cream mask. The perfect one. This is just amazing. It's a leave-on mask. It's gonna be absorbed by your pores. You're gonna feel clean and fresh. Right now it feels wet, but it's gonna be absorbed and it's gonna feel really, really good. There we go. And that's it. The only thing is that please don't wash your face for the next 8 hours. If you can, don't get your face wet. I know it's gonna be difficult, but try not to sweat if it's possible. So if you go to the gym, at least avoid it today. So we let the face mask sink into the pores, okay? And also the recommendations that I gave you about your bedding and going to a doctor that checks your hormones. This is definitely a pattern that it's a breakout due to the hormones. Maybe something that you're eating that is making your hormones go a little bit nutty. So you want to check that out. Yeah, with an endocrinologist is going to help you. Is there anything else that I can do for you today? Well, again, it was a pleasure seeing you. If you need anything, please text me. You know that I'm always available for you. And if you have questions about the soap that I was recommending you, also text me. Actually, I'm going to text you the picture of the soap. It's just amazing and quite affordable. Way better than Tide. Very good. So I will see you in our next appointment. I think we have one for a face massage, right? Well, we have to clear up first all of this. Okay. It was my pleasure. Please take care. Bye-bye.